My name's Gemma Summerfield and I'm studying the Nursing Associate course. So the course is run over 2 years. It's a mixture of coming into uni and also going on placements. So for the first year you have 4 placements which get completed. They go over a 4-week blocks, and the same in the second year. It's a mixture of assignments, a couple of exams, and then there's also been a couple of presentations as well. So I've worked in the care industry for over 20 years. It's been all different areas, so elderly, children, learning disabilities, and I think it was after my daughter, who is now 6, my passion kind of developed for midwifery, and I decided that I was gonna do something about it. My grandma sadly passed away from cancer during COVID, and she was a nurse. She always was a nurse and a carer, and I kind of wanted to make her proud. I then lost my other grandmother, who was a nurse as well. So it was kind of it was what prompted me to make it a profession. And I wanted to go to university, preferably in Plymouth, so that I could do the 3-year course. However, because I've got young children, it wasn't feasible, because it's a long distance to drive. You're going to be at university down there for long hours probably. There's placements where you're not quite sure where you're going to be placed. So I had to look around, and after the Access course, they suggested the option of the Nursing Associate course on this at the university centre. So I came over, and they were doing an event which my cohort came along to, and they talked through it all, and it's on the path that I want to go. It's 2 years. Like I said, it's a mixture of assessments and placements, and the benefit of doing the Nursing Associate course is at the end of it you get a pin and you are put on the NMC register, so you're recognised as an official health professional. And then, if you wish, you can go on to, which me and a couple of my other cohort members have done. In January, we're going to Exeter School of Nursing via Plymouth Uni, and we're going to be doing our top-up. The good thing about the Nursing Associate course here is it comes with honours. So because you're doing your research proposal component of it, you get to miss out on certain parts of the Exeter programme because you've already done it here. So we start in January, and that's for 18 months, and then you become a qualified registered nurse. Every time I make a plan, it goes wrong, or there's a bump in the road, and that's because there's a few factors. I mean, I'm classed as a mature student, and I've got 5 children, so I've got a lot of challenges to contend with. I had to do my maths functional skills because I didn't get a C or above in that. So I had that added also. So the road I wanted to take wasn't going to be right for me or my family. So I chose a different route, and now I'm going to follow this one, and I'm hoping to qualify as a nurse. And depending on my family situation, I may stay as a nurse, and I'd like to work in the community because then the hours are more suited to families. However, I do like the hustle and bustle of the hospitals. And then when the time's right, I'd like to do my top up for midwifery.